This is the human brain. The brain is surrounded by three meninges called dura mater, arachnoid matter, and pia mater, as arranged from outside inwards. These three membranes are continuous with those of the spinal cord through the foramen magnum. As the brain is removed from the cranial cavity, it comes out with the pia mater. This is the brain with the covering pia mater. It is a soft vascular membrane which directly covers the surface of the brain and dips into its sulci and fissures. This is the pia mater, seen dipping into a sulcus on the surface of the brain, carrying with it the blood vessels. Between the pia mater and arachnoid matter lies the subarachnoid space, which is filled with the cerebrospinal fluid. There are sites where the subarachnoid space is deeper than elsewhere and are called subarachnoid cisterns. Here lies the cerebello-medullary cistern, which lies on the back of the brain stem between the medulla oblongata and the cerebellum. Here lies the cisterna pons, which lies in front of the pons and the medulla oblongata and contains the vertebral and the basilar arteries. Here is the interpeduncular cistern. On the base of the brain, where it fills the interpeduncular fossa. This is the interpeduncular fossa, in front of the two cerebral peduncles. It contains the arteries of the circulus arteriosus. This is the cistern of the lateral sulcus, and contains the middle cerebral artery. This is the middle cerebral artery. Let us start with the veins of the brain. They lie either on the surfaces of the hemisphere, where they drain the cerebral cortex and are called external veins, or lie inside the hemisphere, where they drain the basal nuclei and nerve tracts and are called internal veins. In general, the venous blood from the brain goes to the dural venous sinuses, for example the cavernous, transverse and the petrosal sinuses, and eventually through them to the internal jugular veins. The veins on the upper part of the superolateral surface converge on the superior sagittal sinus. The veins on the lower part of the surface drain into the superficial middle cerebral vein, which lies between the lips of the posterior ramus of the lateral sulcus and carries the blood to the cavernous sinus. On the medial aspect of the hemisphere lies the great cerebral vein. It emerges just below the splenium of the corpus callosum. It is formed by the union of the two internal cerebral veins, each of which drains one hemisphere. The great cerebral vein, which is a single vein, passes backwards to join the inferior sagittal sinus to form the straight sinus, which lies in the midline of the tentorium cerebellar. This is the opening of the cut great cerebral vein, emerging under cover of the splenium of corpus callosum. Here lies the straight sinus in the midline of the tentorium cerebelli, which covers the upper surface of the cerebellum. This is the cerebellum, and these are the occipital lobes of the cerebral hemispheres. Now, let us demonstrate the arteries of the brain, which are more important. The arteries of the brain are derived from two sources. The first source is from the internal carotid arteries, each of which enters the skull through the carotid canal. The second source is from the vertebral arteries, which enter the skull through the foramen magnum. This is the internal carotid artery, seen after leaving the cavernous sinus. It ends immediately below the anterior perforated substance of the brain, just lateral to the optic chiasma, where it gives off the middle cerebral and anterior cerebral arteries, in addition to the posterior communicating and anterior choroid arteries. This is the cut end of the internal carotid artery. This is the middle cerebral artery. This is the anterior cerebral artery. This is the posterior communicating artery. And this is the anterior choroid artery. This is the optic chiasma. And this is the anterior perforated substance just lateral to the chiasma at the base of the brain. And this is the cut end of the internal carotid artery just lateral to the optic chiasma. This is the posterior communicating artery. It passes backwards to join the posterior cerebral artery. This is the anterior cerebral artery. It runs forwards above the optic chiasma to gain the medial side of the cerebral hemisphere. Near its origin, it joins its fellow of the opposite side by the anterior communicating artery. This is the medial surface of the brain, showing the course of the anterior cerebral artery. This is the beginning of the artery, as it passes above the optic chiasma. It then curves around the genu of corpus callosum and then passes backwards on the medial surface of the brain as far as the parieto-occipital sulcus. That's to say, about the level of the splenium of corpus callosum, where it ends. It gives off cortical branches to the cortex of the brain on the medial surface of the hemisphere. Its branches cross the superior border of the hemisphere to supply 1 finger breadth of the superolateral surface. Note that this artery supplies the leg and the perineum area, which lies in the paracentral lobule on the medial surface of the hemisphere. It also gives off central branches. These are the central branches which perforate the anterior perforated substance to supply the interior of the hemisphere. This is the middle cerebral artery, arising from the internal carotid artery. It runs in line with the internal carotid artery and thus is more frequently involved by emboli which pass through the artery. The middle cerebral artery at first runs laterally in the stem of the lateral sulcus, then backwards on the floor of the insula. This is the insula, and this is the middle cerebral artery running on its floor. To expose this artery, one has to open the lips of the insula. Alongside the artery runs the deep middle cerebral vein. The middle cerebral artery gives off cortical and central branches. The cortical branches supply the cortex of the superior-lateral surface, except the uppermost 1 finger breadth, which is supplied by the anterior cerebral artery. These are the cortical branches of the middle cerebral artery, coming out through the lips of the lateral sulcus. The central branches enter the anterior perforated substance to supply the corpus striatum. Hence, they are called striate arteries. It should be noted that the central branches are end arteries as they do not anastomose with neighboring arteries, while the cortical branches anastomose with neighboring arteries on the surface of the cortex. But once they pierce the cortex, they do not anastomose anymore. Obstruction of an end artery leads to destruction of the area of brain tissue supplied by this artery. This is the anterior choroidal artery, passing to the inferior horn of the lateral ventricle. This is the 4th part of the vertebral artery. The 2 arteries unite together at the lower border of the pons to form the basilar artery. Each artery ascends on the anterolateral aspect of the medulla oblongata, close to the rootlets of origin of the hypoglossal nerve. It gives off medullar branches to the anterior part of the medulla. It also gives off the anterior and posterior spinal arteries, which descend to supply the spinal cord. Also, it gives off the posterior inferior cerebellar artery. This is the posterior inferior cerebellar artery, which is the largest and more important branch. It passes backwards with a tortuous course among the rootlets of the glossopharyngeal and the vagus nerves on the side of the medulla to reach the inferior surface of the cerebellum. It supplies the lateral aspect of the medulla as well as the inferior surface of the cerebellum. If obstructed, it leads to what is called lateral medullary syndrome or posterior inferior cerebellar artery syndrome. This is the posterior inferior cerebellar artery in another specimen. This is a medullary branch to the medulla. This is a spinal branch descending to the spinal cord. This is the basilar artery. It runs in the midline of the anterior aspect of the pons in a sulcus called the basilar sulcus. It begins at the lower border of the pons and ends at its upper border by dividing into two posterior cerebral arteries. It gives off pontine branches to the pons, labyrinthine artery, which enters the internal auditory meatus, the anterior inferior cerebellar artery, to the anterior part of the inferior surface of the cerebellum. The basilar artery also gives off the superior cerebellar artery to the upper surface of cerebellum, and then it ends by dividing into the two posterior cerebral arteries which supply the occipital lobes of the brain. This is the posterior cerebral artery. It winds backwards on the lateral aspect of the midbrain to sink into the calcarine sulcus on the occipital lobe of the brain. The posterior cerebral artery gives off central branches which perforate the base of the brain at the posterior perforated substance. And then ramifies on the surface of the occipital lobe. Each posterior cerebral artery receives the posterior communicating artery, which is a branch from the internal carotid artery, thus forming the circulus arteriosus, or the so-called circle of Willis. This circle lies in the interpeduncular fossa at the base of the brain and is formed as follows. First, by the two anterior cerebral arteries, which are joined by the anterior communicating artery. Second, by the two posterior communicating arteries, as they arise from the internal carotid arteries of both sides. Thirdly, by the two posterior cerebral arteries, as they arise from the basilar artery. The importance of this big anastomosis is to allow the blood to circulate between the internal carotid arteries and the vertebro-basilar system, as well as between the arteries of both sides. This is the circle of Willis in another specimen, seen as diamond-shaped. These are the two anterior cerebral arteries. These are the posterior communicating arteries. and these are the two posterior cerebral arteries. Now, let us demonstrate the parts of the brain. The brain consists of two cerebral hemispheres, two cerebellar hemispheres, and the brain stem. The brain stem consists of the medulla oblongata, pons, and midbrain from below upwards. The medulla oblongata extends from the lower border of the foramen magnum to the lower border of the pons. It is bulb-like, and hence lesions in the medulla leads to bulbar paralysis, and the pyramidal fibers ending in the brain stem are called corticobulbar fibers. This is a sagittal section in the brain stem to show the parts of the medulla oblongata. The medulla oblongata is divided into two parts called open medulla and closed medulla. The open medulla is the upper part and the ventricle behind it, while the closed medulla is the lower part and has a central canal inside it. By open medulla is meant that its posterior part is open to form the fourth ventricle. This is the anterior surface of the medulla. It shows the anterior median fissure in the midline. On each side of this fissure lies a pyramidal elevation called the pyramid. This pyramid contains the pyramidal or corticospinal fibers, which are the upper motor neuron fibers. Lateral to the pyramid lies the olive, which is an olive-like swelling produced by a big nucleus called the olivary nucleus, which is a part of the extrapyramidal system. The groove between the pyramid and olive shows the fine rootlets of the hypoglossal nerve. The hypoglossal nerve is the 12th cranial nerve and supplies the muscles of the tongue. Notice the close relation of the hypoglossal nerve to the pyramid, because if a lesion occurs here, both structures are vulnerable to the damage. This condition is called alternating hypoglossal hemiplegia. Lateral to the olive lies a longer elevation passing from the middle of the side of the medulla to the cerebellum. And is called the inferior cerebellar peduncle. It carries mainly, but not wholly, fibers from the spinal cord and medulla oblongata to the cerebellum. The groove between the olive and the inferior cerebellar peduncle shows the rootlets of the glossopharyngeal, vagus, and accessory nerves, as arranged from above downwards. The glossopharyngeal is the 9th cranial, the vagus is the 10th cranial, while the accessory is the 11th cranial. At the junction between the medulla and the pons, notice the attachment of the abducent or 6th cranial nerve at the base of the pyramid. Notice also the attachments of the facial, which is the 7th cranial, and the auditory, which is the 8th cranial. Both lie on the side in line with the 9th, 10th, and 11th nerves at an angle called cerebello-pontine angle. At this angle, notice the presence of the lateral termination of the choroid plexus and the lateral aperture of the 4th ventricle. A tumor of this angle will compress the 7th and 8th nerves as well as the neighboring cerebellum. Notice that each of the cranial nerves as a whole has a deep origin from a nucleus or more inside the brain stem and leaves the brain surface at its superficial attachment. The olfactory and optic nerves, which are the 1st and 2nd cranial, are attached to the cerebral hemispheres directly. This is the posterior surface of the medulla oblongata. Its lower half shows the gracile and the cuneate fasciculi as longitudinal bands on each side of the posterior median sulcus. The gracile fasciculus or tract is the medial, while the cuneate fasciculus is the lateral. These two fasciculi end above in the gracile and the cuneate tubercles. This is the gracile tubercle, and this is the cuneate tubercle, which are produced by the gracile and the cuneate nuclei. The upper half of this surface of the medulla enters into the formation of the 4th ventricle as it belongs to the open medulla. This is the pons. Its anterior or basilar part shows the sulcus for the basilar artery. From each side of this basilar part, the middle cerebellar peduncle runs laterally to enter the cerebellum. At the junction between the body of the pons and the middle peduncle lies the superficial attachment of the trigeminal nerve, which is the thickest cranial nerve, which is cut flush with the surface of the pons. On the surface of the pons, notice the perforation of the pontine vessels, which are branches from the basilar artery. This is the posterior surface of the pons. Which forms the floor of the 4th ventricle, and will be described soon with the 4th ventricle. This is a cut section of the midbrain, which is the upper part of the brain stem. It shows the cerebral aqueduct, which traverses the midbrain vertically near its posterior part and connects the 3rd ventricle above with the 4th ventricle below. The plane of the cerebral aqueduct separates the tectum posteriorly from the tegmentum anteriorly. The tegmentum is related anteriorly to a dark strip of gray matter called substantia nigra, which separates the tegmentum from the crus cerebri. This is the crus cerebri, one on each side, and consists of descending fibers. The middle 3/5 of the crus lodges the pyramidal fibers, which continue downwards in the basilar part of the pons and then in the pyramid of the medulla oblongata, and finally form the corticospinal fibers. The midbrain consists of two cerebral peduncles, one on each side of the midline. This is the right peduncle and this is the left peduncle. Each peduncle consists of the crus cerebri anteriorly, followed by the substantia nigra, then more posteriorly by the tegmentum. They should be differentiated from the cerebellar peduncles, which connect the brainstem with the cerebellum. This is the posterior aspect of the midbrain, showing the tectum, which consists of 4 colliculi, 2 superior and 2 inferior. The superior colliculus is a reflex center for vision, while the inferior colliculus is a reflex center for auditory impulses. The superior colliculus is connected with the lateral geniculate body by a ridge of fibers called the brachium of superior colliculus. The inferior colliculus is connected with the medial geniculate body by a similar brachium called the brachium inferior colliculus. This is the inferior colliculus. This is the inferior brachium, and this is the medial geniculate body. This is the superior colliculum. This is the superior brachium, and this is the lateral geniculate body. The medial and the lateral geniculate bodies form what is called the metathalamus, which is a part of the diencephalon. Just below the inferior colliculus, the superior cerebellar peduncle sinks into the back of the midbrain, one on each side of the midline. This is the frenulum velar, extending from the midline between the 2 inferior to the upper part of the roof of the 4th ventricle. This is the pineal body, lying in the midline above the 2 superior colliculi. This is the lateral aspect of crus cerebri of midbrain, crossed by the posterior cerebral artery and the optic tract, which ends in the lateral geniculate body. The optic tract crosses the uppermost part of the side of the crus. The posterior cerebral artery passes backwards from its origin from the basilar artery to reach the occipital lobe. This is the midbrain seen from the back in another specimen to show the trochlear nerve, as it emerges from the back of the brain stem just below the inferior colliculus. This is the inferior colliculus. This is the trochlear nerve as it curves forwards on the lateral side of the crus of the midbrain. This is the anterior aspect of the midbrain, showing the two crura which are separated by the posterior part of the interpeduncular fossa. Here, the oculomotor nerve, which is the third cranial nerve, leaves the midbrain on the medial side of the crus cerebri and runs straight forward. These are the structures in the interpeduncular fossa. This is the posterior perforated substance, which is the most posterior. These are the two mammillary bodies. This is the tuber cinereum. And here is the optic chiasma, which is the most anterior. The borders of the interpeduncular fossa are formed on each side by the optic tract anteriorly and the crus cerebri posteriorly. This is the cerebellum. It lies in the posterior cranial fossa on the back of the pons and medulla, from which it is separated by the fourth ventricle. It consists of two hemispheres and a median part called the vermis. This vermis bulges on the superior surface, where it is called superior vermis, and also bulges into a deep hollow on the inferior surface, where it is called the inferior vermis. The two hemispheres are partially separated anteriorly by an anterior notch which lodges the brain stem. And posteriorly by a posterior notch which lodges the falx cerebellar. This is the superior surface of the cerebellum. It shows multiple transverse fissures, the important of which are the fissura prima, horizontal fissure, and posterolateral fissure. This is the fissura prima, or primary fissure, which is V-shaped and cuts across the superior surface. Its apex lies at the junction of the anterior 2/3 with the posterior third and separates the anterior lobe from the middle lobe. This is the anterior lobe, and this big part is the middle lobe. However, the posterior lobe is a degenerated part on the inferior surface and is called the flocculonodular lobe and will be demonstrated soon. This is the horizontal fissure. It begins at the point of insertion of the middle peduncle and extends along the junction between the superior and the inferior surfaces of the cerebellum to the posterior notch. The posterolateral fissure lies on the inferior surface and just behind the flocculo-nodular lobe. This is the inferior surface of the cerebellum. This is the inferior vermis. This is the flocculo-nodular lobe, which lies on the inferior surface of the cerebellum. It consists of the nodule and the flocculus, together with the inferior medullary velum in between. This is the nodule, which is the most anterior part of the inferior vermis. The part of the inferior vermis just behind the nodule is called the uvula and is related on each side to a circumscribed mass called the tonsil. This is the tonsil. It lies on a bed formed by the inferior medullary velum. Thus, to display the inferior medullary velum, one has to remove the tonsil. Note that the inferior medullary velum stretches from the nodule medially to the flocculus laterally. This is a sagittal section in the cerebellar hemisphere. It shows the following features. These are the fissures which separate the folia. In the core of each folium extends a branch of white matter, thus giving the section a branched appearance called arbor vitae. This is the superior vermis in median section. Its most anterior part is called the lingula and rests upon the superior medullary velum just below the inferior colliculus. This is the inferior vermis in median section. This space is the fourth ventricle. This is its roof related to the cerebellum. And this is its floor formed by the pons and open medulla. The details of its description are coming soon. This is a horizontal section in the cerebellar hemisphere to show the dentate nucleus. It is called dentate because its surface has dentations like teeth. It gives rise to most fibers of the superior cerebellar peduncle. This is another horizontal section in the cerebellum which is stained to show the dentate nucleus. The dentations are clearly seen. Now let us demonstrate the fourth ventricle. This is the fourth ventricle, as seen in sagittal section. It appears as tent-like and lies behind the pons and open medulla, which form its floor. It is covered posteriorly by the cerebellum. Its roof is formed by the superior and inferior medullary vela. This is the superior velum, and this is the inferior velum. The ventricle is continuous above with the cerebral aqueduct, and below with the central closed medulla. This is the fourth ventricle as seen from the back after removal of the cerebellum. It appears to be diamond in shape and is wide at the level of junction of the pons with the open medulla. Here it extends laterally on each side to form a thin ependymal tube called the lateral recess. This recess runs on the back of the inferior cerebellar peduncle to open at the tip of the flocculus through the lateral aperture of the fourth ventricle. This is the cerebellopontine angle. This is the opening of the lateral recess of the fourth ventricle. This is the choroid plexus bulging through this opening. This is the flocculus. This is the ninth cranial nerve just anterior to the lateral recess. This is the seventh and eighth nerves emerging at the cerebellopontine angle, just above the flocculus. A cerebellopontine angle tumor will compress all these structures. The roof of the fourth ventricle is formed from above by the superior medullary velum extending between the two superior cerebellar peduncles, and from below by the inferior medullary velum extending between the two inferior cerebellar peduncles. This inferior medullary velum is removed with the cerebellum to expose the floor of the fourth ventricle. Inside the ventricle projects a choroid plexus of arteries surrounded by pia mater called tela choroidi of the fourth ventricle. It extends laterally on each side as far as the lateral aperture of the ventricle. This is the floor of the fourth ventricle. It is diamond-shaped and is bounded on each side by the superior peduncle, inferior peduncle, cuneate tubercle, and gracile tubercle from above downwards. It is formed of a pontine part belonging to the back of the pons and a medullary part belonging to the back of the open medulla. The junction between the two parts is demarcated by bundles of fibers which run transversely from the median groove laterally towards the inferior peduncle and are called the medullary striae. The pontine part shows a medial swelling, a lateral swelling, and a superior fovea in between. The medial swelling, one on each side of the median groove, is called facial colliculus and is formed by the abducent nucleus together with the fibers of the facial nerve curving around it. The lateral swelling overlies the vestibular nuclei and forms the upper part of the vestibular area. This is the superior fovea, which is an angular depression between the two elevations. The medullary or lower part of the floor is divided by a depression called inferior fovea into 3 triangles. The medial triangle lies over the hypoglossal nucleus and is called hypoglossal triangle. The intermediate triangle overlies the dorsal nucleus of the vagus and is called the vagal triangle, while the lateral triangle overlies the vestibular nuclei and forms the lower part of the vestibular area. Now, let us demonstrate the cerebrum. This is the base of the brain. This is the interpeduncular fossa on the base of the brain. Its boundaries and contents have been mentioned before. It should be noted that the contents of the interpeduncular fossa form the floor of the third ventricle, and it is a part of the hypothalamus. And one should remember that the circle of Willis lies in this fossa. These are the 2 cerebral hemispheres, which are separated from each other by the longitudinal fissure, which lodges the falx cerebral. Each hemisphere has 3 surfaces and 3 poles. The surfaces are the superolateral, the medial, and the inferior surfaces. The inferior surface is divided into a tentorial part posteriorly in relation to the tentorium cerebelli and an orbital part anteriorly in relation to the roof of the orbit. The 3 poles are frontal, temporal, and occipital poles. Each hemisphere is divided into 4 lobes by 3 lines. One line corresponds to the central sulcus, and this line separates the frontal lobe in front from the parietal lobe behind. The second line extends from the parieto-occipital sulcus down to the pre-occipital notch, which is a notch on the infero-lateral border about 3 centimeters in front of the occipital pole. This imaginary line separates the parietal lobe from the occipital lobe. The third line is the posterior ramus of the lateral sulcus and separates the temporal lobe below it from both the parietal and the frontal lobes above. For the purpose of more clarification, the lines separating the lobes of the cerebrum from each other are demarcated by red lines. This is the central sulcus, and this is the frontal lobe. This is the parieto-occipital sulcus, and the line extended from it to the pre-occipital notch. And this is the posterior ramus of the lateral sulcus, and its backward extension. This is the parietal lobe behind the central sulcus. This is the temporal lobe below the posterior ramus of the lateral sulcus. And this is the occipital lobe behind the line of the parieto-occipital sulcus. Let us proceed to demonstrate the main sulci and gyri of the cerebral cortex. This is the superior-lateral surface of the left cerebral hemisphere. This is the frontal pole. This is the occipital pole. And this is the temporal pole. This is the central sulcus. It begins at the superior border, midway between the frontal and occipital poles, hence the name central. It passes downwards and slightly forwards to end at 1 inch behind the origin of the posterior ramus of the lateral sulcus, but does not cut into this sulcus. The central sulcus is always a single sulcus and is not interrupted as the case with the pre-central or post-central sulci, which may be divided into two parts. The central sulcus curves at the superior border of the hemisphere to cut into the medial surface. The area around its end is called the paracentral lobule, and it lodges the area for perineum and foot. The central sulcus intervenes between the pre-central gyrus and the post-central gyrus. This is the pre-central gyrus, and this is the post-central gyrus. The pre-central gyrus occupies the motor area from which most of the pyramidal fibers arise, while the post-central gyrus occupies the sensory area which receives the somatic sensations like proprioception, pain, touch, and temperature from the opposite side of the body. It should be noted that one cerebral hemisphere controls the opposite side of the body, that's to say, the contralateral side. This is in contrast to the cerebellar hemisphere, which controls the same side of the body, that's to say, the ipsilateral side. This is the lateral sulcus. It is called lateral because its stem runs laterally between the temporal pole and orbital surface. It transmits the middle cerebral artery. The stem ends on the superior-lateral surface by dividing into three branches or rami called anterior, ascending, and posterior. These are the anterior and ascending rami, which are short and cut into the inferior frontal gyrus. This is the horizontal longer posterior ramus, which forms the limit between the temporal lobe below it and both the frontal and the parietal lobes above it. If its lips are pulled apart, the insula is exposed in the floor of this sulcus, which is a hidden part of the cerebral cortex, having the middle cerebral artery running over its surface. The frontal lobe bounded by the frontal pole anteriorly and the central sulcus posteriorly. It is divided by two horizontal sulci into three frontal gyri: superior frontal, middle frontal, and inferior frontal gyri. The inferior frontal gyrus receives the anterior and ascending rami of the lateral sulcus, and this area is the motor speech or area of Broca. It is said to be well developed on the left hemisphere. Its damage leads to motor or expressive aphasia, that's to say, inability to speak. This is the precentral gyrus, and this is the precentral sulcus. It is parallel and in front of the central sulcus and carries the motor area, where the body is represented from upside down with the leg in the uppermost part, while the tongue, larynx, and lips in its lowermost part. This gyrus corresponds to the course of the anterior division of the middle meningeal artery, and in case of hemorrhage from that artery, the hematoma may compress this gyrus, leading to paralysis on the opposite side, that's to say, contralateral hemiplegia. This is the parietal lobe. Bounded by the central sulcus anteriorly and by a line passing from the parieto-occipital sulcus to the pre-occipital notch. This is the parieto-occipital sulcus, which separates the parietal lobe from the occipital lobe. The main part of this sulcus lies on the medial surface, but it cuts into the superior border of the hemisphere to appear on the superolateral surface. This is the reverse of the central sulcus, which runs most of its course on the superolateral surface, but curves on the medial surface for a short distance. The parietal lobe shows the following sulci and gyri. This is the post-central sulcus, forming the posterior boundary of the post-central gyrus, which carries the sensory area of the opposite side of the body, with the body being represented in it in an upside-down way, the same as in the pre-central gyrus. This cortical sensory area receives the sensations conveyed by the medial lemniscus, trigeminal lemniscus, and spinal lemniscus. These sensations are proprioceptors, pain, touch, and thermal. The curved gyrus around the end of the posterior ramus of the lateral sulcus is called supramarginal gyrus, while the part around the end of the superior temporal sulcus is called angular gyrus. These supramarginal and angular gyri are important centers for recognition of the structures and their meanings, a condition called stereognosis. It also contains the sensory speech area, in which the meaning of spoken words can be recognized. An injury to this area leads to what is called sensory or receptive aphasia, which means inability to understand spoken or written words. This is the occipital lobe, bounded by the occipital pole posteriorly and by a line passing between the parieto-occipital sulcus and the pre-occipital notch. It shows a curved sulcus near the occipital pole called leonate sulcus. It lies at the terminal end of the calcarine sulcus. The calcarine sulcus lies mainly on the medial surface of the hemisphere. The leonate sulcus forms the limit of the visual area on the superolateral surface. The main site of the visual area is around the calcarine sulcus on the medial surface. This is the temporal lobe. It is bounded by the temporal pole, the posterior ramus of the lateral sulcus, and posteriorly by a line passing from the parieto-occipital sulcus to the pre-occipital notch. It is divided by two horizontal parallel sulci called the superior and inferior temporal sulci into three gyri called superior, middle, and inferior temporal gyri. The middle of the superior temporal gyrus carries the auditory area. This area extends deeply onto the buried gyri of the insula. Therefore, most of the auditory area is hidden by the lips of the posterior ramus of the lateral sulcus. Note also that the auditory area lies opposite the lower end of the post-central gyrus. To sum up, the sulci and the gyri on the superolateral surface, this is the central sulcus. This is the pre-central sulcus. This is the post-central sulcus. This is the pre-central motor gyrus. This is the post-central sensory gyrus. All are vertical. These are the superior, middle, and inferior frontal gyri, which are horizontal. The inferior frontal gyrus shows the anterior and ascending rami of the lateral sulcus, cutting into it. This is the posterior ramus of the lateral sulcus. This is the superior temporal sulcus. This is the inferior temporal sulcus, all running horizontally parallel to each other. This is the terminal end of the parieto-occipital sulcus. This is the leonate sulcus, which is concave towards the occipital pole. Now let us move to the medial surface of the hemisphere. The medial surface is demarcated by the corpus callosum, which appears in cut section as a curved mass of white fibers having a genu anteriorly, a trunk, and splenium posteriorly. The distance between the splenium and the occipital pole is longer than the distance between the genu and the frontal pole. This is the calcarine sulcus, with its two rami, thus forming a Y-shaped arrangement. It transmits the posterior cerebral artery. The continuation of the calcarine sulcus to the occipital lobe is called post-calcarine sulcus, while its ramus, which runs up to the superior border, is the parieto-occipital sulcus. The area bounded by the post-calcarine and the parieto-occipital sulci is triangular in shape and called cuneus. The quadrangular area just in front of the parieto-occipital sulcus and bounded anteriorly by the upturned terminal part of the cingulate sulcus is called precuneus. This is the cingulate sulcus or sulcus cinguli, which begins below the geno of corpus callosum and runs backwards parallel to the end near the splenium by turning upwards to reach the superior border. Shortly before its end, it gives off a vertical branch at about the middle of the corpus callosum. The area bounded by this vertical branch and the termination of the cingulate sulcus is called paracentral lobule, into which the central sulcus cuts. This lobule carries the motor and sensory area of perineum and foot. The gyrus bounded by the stem of the cingulate sulcus and the corpus callosum is called cingulate gyrus. The sulcus, which lies between the cingulate gyrus and the trunk of corpus callosum, is called callosal sulcus. The gyrus in front of the paracentral lobule as far as the frontal pole is called medial frontal gyrus. The sulci and gyri on the inferior surface of the hemisphere are as follows. This is the posterior tentorial part of the inferior surface. It shows two antero-posterior parallel sulci, the latter of which is called occipito-temporal sulcus and is divided into two parts. The medial sulcus is called collateral sulcus. This is the rhinal sulcus, which lies in line with the collateral sulcus and bounds the uncus laterally. This is the uncus, which is a center for smell. The gyri of this surface are as follows from lateral to medial. This is the lateral occipito-temporal gyrus. This is the medial occipito-temporal gyrus. This is the lingual gyrus, which is a center for vision. It runs below the stem of the calcarine sulcus and continues forwards below the splenium to merge into the para-hippocampal gyrus. This is the para-hippocampal gyrus, which forms the free medial border of the hemisphere. It lies close to the side of the midbrain. The para-hippocampal gyrus is related deeply to a gray mass called hippocampus, hence the name para-hippocampal gyrus. It continues forwards to form the uncus at the temporal pole. The uncus is bounded from the remainder of the temporal lobe by the rhinal sulcus. This is the orbital part of the inferior surface. It rests over the roof of the orbit. It shows an H-shaped sulcus, and its posterior limit is separated from the temporal pole by the stem of the lateral sulcus. Parallel to its medial border lies the olfactory tract, with its swollen anterior end called olfactory bulb. The olfactory bulb and the tract lie in the olfactory sulcus. The gyrus medial to the olfactory sulcus is called gyrus rectus. This is the olfactory tract. Following it posteriorly, it divides into medial and lateral parts, which includes the anterior perforated substance. This substance is perforated by central arteries of the anterior and middle cerebral arteries. The olfactory bulb and tract form a part of the rhyncephalon, which is the part of the limbic system concerned with smell. This is another specimen showing the anterior perforated substance perforated by the central arteries. This is the paraterminal gyrus, lying in front of the lamina terminalis and below the rostrum of corpus callosum. This is the lamina terminalis, and this is the rostrum of corpus callosum. This is the cingulate gyrus, curving backwards around the splenium to become continuous with the parahippocampal gyrus. Note that just behind the splenium, the cingulate gyrus and the lingual gyrus join the parahippocampal gyrus. It should be noted that the cingulate gyrus and the parahippocampal gyrus are two main gyri of the limbic system. Now we are going to demonstrate some of the parts of the limbic system. This is the gyrus fasciolaris, which is a small ridge of gray matter on the inferior surface of the splenium of corpus callosum. This gyrus is continuous anteriorly with a slender gyrus having transverse notches like teeth, and hence is called dentate gyrus, which lies on the medial surface of the parahippocampal gyrus and is situated under cover of the fimbria of the hippocampus. This is the splenium of corpus callosum. This is the posterior end of the cingulate gyrus, which is continuous with the hippocampal gyrus. And this is the body of the fornix just under cover the splenium. This is the temporal lobe, and this is the inferior horn of the lateral ventricle open. This is the dentate gyrus, which is a long, narrow strip of gray matter lying on the upper surface of the hippocampal gyrus under cover of the fimbria. This is the fimbria, which arises from the swollen anterior end of the hippocampus. This fimbria proceeds backwards to become continuous with the crus of the fornix, and this dentate gyrus proceeds backwards to become continuous with the gyrus fasciolaris. This is another specimen of the temporal lobe. This is the anterior temporal pole, and this is the posterior occipital pole. This is the hippocampus in the floor of the inferior horn of the lateral ventricle. This is its swollen, rigid anterior end, and is called pes hippocampi. This is the fimbria of hippocampus, passing backwards to become the crus of the fornix. This is the crus of the fornix, lying in contact with the splenium of corpus callosum. It should be noted that the dentate gyrus lies under cover the fimbria, while the choroidal fissure of the inferior horn lies just above it. Through this choroidal fissure, the choroid plexus of the inferior horn protrudes into the cavity of the horn. This is the body of the fornix, lying over the thalamus and below the posterior part of the trunk of the corpus callosum. This is the thalamus, and this is the corpus callosum. This is the anterior continuation of the fornix, which is called the column of the fornix. It passes forwards and sends downwards in front of the interventricular foramen, which connects the third ventricle with the lateral ventricle. The fornix is continuous posteriorly with its crus, which lies below the splenium of corpus callosum. The column of the fornix is separated from the corpus callosum by a thin sheet of white matter called septum pellucidum. This septum pellucidum forms the medial wall of the anterior horn and the medial wall of the central part of the lateral ventricle. The column of the fornix curves forwards and downwards over the thalamus, from which it is separated by the choroidal fissure, through which the choroid plexus protrudes into the central part of the lateral ventricle. This is the choroidal fissure, and this is the choroid plexus bulging through the interventricular foramen. This is the interventricular foramen of Monroe. It connects the third ventricle with the lateral ventricle. It is bounded posteriorly by the anterior end of the thalamus and anteriorly by the column of the fornix. The column of the fornix sinks into the hypothalamus to end in the mammillary body. At the level of the interventricular foramen, the column of fornix lies just behind the anterior commissure, which is a transverse bundle of fibers connecting the two temporal lobes together. This is the commissure section. This anterior commissure crosses the midline just behind the lamina terminalis. This is the lamina terminalis. The structures in this region from before backwards are as follows. This is the para-terminal gyrus, just in front of the lamina terminalis. This is the lamina terminalis. This is the anterior commissure. This is the anterior column of fornix. This is the interventricular foramen. This is the thalamus, having the body of fornix above it, with the choroidal fissure in between. This is the splenium of corpus callosum, below which lies the crus of fornix. This is the pineal body, protruding backwards above the tectum of the midbrain. This is another specimen with the septum pellucidum removed to show the cavity of the lateral ventricle and the choroid plexus lying on its floor. This is the choroidal fissure between the thalamus and the fornix. This is the body of the thalamus, and below it lies the hypothalamus, with the hypothalamic sulcus in between. This sulcus extends from the interventricular foramen anteriorly to the cerebral aqueduct of the midbrain posteriorly. This is the cerebral aqueduct. It lies between the tectum posteriorly and the tegmentum anteriorly. This is the tegmentum of the midbrain, and this is the tectum of the midbrain. Here lies the cavity of the third ventricle. Its lateral wall is formed by the thalamus above and hypothalamus below. This is the floor of the third ventricle, formed from before backwards by the optic chiasma, tubercinarium, mammillary body, posterior perforated substance, and the tegmentum of the midbrain. In this region, note the following: the tubercinarium, mammillary body, and the posterior perforated substance are parts of the hypothalamus present in the floor of third ventricle. Now, let us demonstrate the third ventricle. It is a single ventricle present exactly in the midline between the two cerebral hemispheres. In this specimen, the third ventricle is specially dissected so as to show its two side walls and its cavity in between. This is the cavity of the ventricle, which is seen to be very narrow and is bounded by its two side walls. This cavity extends from the lamina terminalis anteriorly to the cerebral aqueduct and pineal body posteriorly. This is the lamina terminalis, and this is the pineal body. This is the cerebral aqueduct. The cavity of the third ventricle is traversed by interthalamic connexus, which extends between the two side walls. This is the cavity seen from above and is traversed by interthalamic connexus. Note how narrow the cavity is. The cavity has a roof, floor, and an anterior wall and posterior wall. Let us demonstrate its walls in another specimen. The roof is a thin layer of epidermis invaginated by the tela choroidi of the third ventricle. It is attached to the upper limit of the medial surface of the thalamus, extending from the interventricular foramen anteriorly to the pineal body posteriorly. The lateral wall consists of the thalamus above, the hypothalamus below, and the hypothalamic sulcus in between. The interventricular foramen of Monroe lies in the lateral wall just anterior to the thalamus. The floor of the cavity consists of the following structures from before backwards: the optic chiasma, tuber cinerarium, mammillary bodies, posterior perforated substance, and tegmentum of the midbrain. Note that the hypothalamus lies partly in the lateral wall and partly in the floor of the third ventricle. This is the anterior wall of the ventricle, formed by the lamina terminalis, with the anterior commissure directly posterior to it. Notice the recess, which extends from the cavity downwards towards the optic chiasma. Its posterior wall is formed by the stalk of the pineal body. Now, let us demonstrate the lateral ventricle. The lateral ventricle is a big ventricle which lies in the cerebral hemisphere. It consists of a central part and 3 horns. Each horn extends into one of the lobes of the hemisphere. The anterior horn extends into the frontal lobe in front of the thalamus. This is the thalamus. The posterior horn extends into the occipital lobe behind the thalamus. The inferior horn extends into the temporal lobe below the thalamus. The anterior horn and central part of the ventricle lie under the corpus callosum and are closed medially by the septum pellucidum. In this specimen, the septum pellucidum is removed to show the cavity of the ventricle with two big swellings lying in its floor, which are the caudate nucleus laterally and the thalamus medially. This is the caudate nucleus and this is the thalamus. This is another specimen showing the septum pellucidum intact, thus hiding the cavity from view. This is the septum pellucidum incised and reflected to show the cavity of the ventricle lateral to it. This is the anterior horn. It lies in the frontal lobe. It is the part anterior to the level of the interventricular foramen. It shows the head of the caudate nucleus lying in its floor. It is triangular in cross-section, having a roof, medial wall, and a floor. The roof is formed by the trunk of corpus callosum. The medial wall is formed by the septum pellucidum, and the floor is formed by the rostrum of corpus callosum and the bulging head of the caudate nucleus. This is the rostrum of corpus callosum. This is its genu. This is its trunk. This is a coronal section through the anterior horn of the ventricle. This is the anterior horn. This is the septum pellucidum. Forming its medial wall. This is the trunk of corpus callosum forming its roof. This is the rostrum of corpus callosum in its floor. And this is the swollen anterior end of the caudate nucleus bulging in the lateral part of its floor. The central part of the ventricle begins at the interventricular foramen, that's to say at the anterior end of the thalamus, and ends posteriorly at the splenium of corpus callosum, that's to say at the posterior end of the thalamus. In other words, the thalamus is related only to the central part of the lateral ventricle. It is also triangular in cross-section, having the roof, medial wall, and floor. The roof is formed by the trunk of corpus callosum. The medial wall is formed by the septum pellucidum and the fornix. The floor is formed by many structures which would be demonstrated in another specimen. In this specimen, the roof of the ventricle, which is the corpus callosum, is removed to show the structures on its floor. These structures are from lateral to medial. This is lateral. It narrows progressively from before backwards to end in a narrow tail which lies in the roof of the inferior horn. The thalamus striate vein runs in the groove between the thalamus and the caudate nucleus. The stria terminalis, which is a slender bundle of fibers lying just medial to the thalamus striate vein. Moreover, there are a part of the upper surface of the thalamus together with the choroid plexus and the body of Fornix. Note that the choroid plexus passes into the central part of the ventricle through the choroidal fissure, which lies below the fornix. This is the choroidal fissure. This is the body of the fornix. This is the choroidal plexus. This is the upper surface of the thalamus. This is the groove between the thalamus and the caudate nucleus. This is a coronal section in the central part of the lateral ventricle. This is the trunk of the corpus callosum. Lying in its roof. This is the septum pellucidum and fornix in its medial wall. This is the narrow part of the caudate nucleus in the lateral part of the floor. This is the striate vein cut in section and lying in the groove between the caudate and the thalamus. This is the choroid plexus lying on the upper surface of the thalamus. This is the upper surface of the thalamus. This is the body of the fornix lying on the upper surface of the thalamus. This is the choroid fissure between the fornix and the upper surface of the thalamus. This is the posterior horn of the lateral ventricle. It begins at the splenium, that's to say, just behind the thalamus, and passes backwards into the occipital lobe. It is also triangular in cross-section, having a roof, lateral wall, and floor. The roof is formed by the tapetum, which is the fibers running laterally from the splenium of corpus callosum and then turns downwards in the lateral wall of the posterior horn. The floor forms the inframedial wall of the horn and shows two elevations, the upper of which is produced by the fibers of forceps major and is called bulb of the posterior horn, while the lower elevation is produced by the deep calcareous sulcus and is called calcar avis. This is a coronal section in the posterior horn. This is the tapetum forming its roof, descending in its lateral wall. This area is formed by the forceps major, which comes from the splenium of corpus callosum. This lower swelling is the calcar avis. In this specimen, the lateral ventricle and its inferior horn are demarcated by a red line. The inferior horn is the curved lower part of the ventricle, which curves behind and below the thalamus to run forwards inside the temporal lobe towards the temporal pole. This is the inferior horn. It is also triangular in cross-section, having a roof, a floor, and a lateral wall. The roof is formed by the stria terminalis and tail of caudate nucleus. The floor of the inferior horn shows two elevations, the medial of which is produced by the hippocampus, which is a curved mass with a swollen anterior end called the pes hippocampi. The hippocampus narrows posteriorly and shows a bundle of fibers on its medial border called the fimbria of the hippocampus. Lateral to the hippocampus lies another elevation produced by the deep collateral sulcus and is called the collateral eminence. Note that lateral to the hippocampus lies another elevation produced by the deep collateral sulcus and is called collateral eminence. This eminence is not clearly seen in this specimen, a variation which is common in the brain. Note that the choroidal fissure of the inferior horn lies just above the fimbria, and that the fimbria lies over the dentate gyrus. Note again that the fimbriae continues posteriorly with the crust of Fornix on the inferior surface of the splenium of corpus callosum. Note also that the two deep sulci project into two horns of the lateral ventricle. The calcarine sulcus sinks into the posterior horn to form its bulb, while the collateral sulcus sinks into the inferior horn to form the collateral eminence. Now let us demonstrate the corpus callosum. This is the corpus callosum. It is a mass of commissural fibers extending between the medial surfaces of the two hemispheres, lying nearer the anterior than the posterior ends of the hemispheres. It forms the floor of the longitudinal fissure. In cut section, it consists of a main horizontal part called the trunk, which ends in a free posterior end called the splenium, and ends anteriorly by making a bend called the genu. From the genu, the corpus callosum extends backwards to form the rostrum, which ends at the upper end of the lamina terminalis. The splenium is thick and rounded, and its fibers extend between the occipital and the temporal lobes of both sides. Its fibers, which run backwards in the medial wall of the hemisphere towards the occipital pole, form the forceps major, thus called because the fibers of both sides look like the forceps. Some other fibers of the splenium pass the roof, the posterior horn of the lateral ventricle, and then curve downwards lateral to the posterior and the inferior horns of the lateral ventricle. These fibers form what is called the tapetum. The fibers of the trunk of corpus callosum pass horizontally to connect to the parietal lobe and the posterior parts of the frontal lobes of both sides. The genu connects the anterior parts of the frontal lobes of both sides together. The fibers of the genu, curving forwards towards the frontal pole, form what is called forceps minor, because they are shorter than the forceps major formed by the splenium. Other commissural fibers are the anterior commissure and posterior commissure. This is the anterior commissure. It crosses the midline just in front of the column of the fornix. It connects the temporal lobes of both sides together. Here lies the posterior commissure. It crosses the midline posteriorly, immediately below the root of the pineal body. Now, we will move to demonstrate the insula. The insula is a part of the cerebral cortex buried deep to the lateral sulcus. The cortex overlying the insula forms a kind of lids called opercula. A part belongs to the frontal lobe, a part belongs to the parietal lobe, and a part belongs to the temporal lobe. These opercula form the lips of the posterior horn of the lateral sulcus. Pulling these opercula apart exposes the insula, which is triangular in outline and is surrounded by a circular sulcus. The surface of the insula consists of sulci and gyri radiating from the stem of the lateral sulcus at the apex of the insula. This is the floor of the insula, exposed after removing its opercula. This is the circular sulcus surrounding the floor. These are the gyri radiating from the stem of the lateral sulcus. These are the middle cerebral artery and the accompanying deep middle cerebral vein running on the floor of the insula. Now let us move to the sections of the brain to demonstrate the basal nuclei. Let us start with the horizontal section in the cerebral hemisphere. The section is taken from side to side in the horizontal plane. This is the horizontal section. We have to define at first the medial and lateral borders, as well as the anterior and posterior ends of the section. The medial border is straight, but the lateral border is convex. The medial border shows a big mass of gray matter, which is the thalamus, while the lateral border shows the insula, which appears as flask-like in section. The anterior end of the section is nearer to the corpus callosum than the posterior end. Then we will take the thalamus as a guide. The cavity just in front of it is the anterior horn of the lateral ventricle, with the head of caudate nucleus bulging into it. The geno of corpus callosum forms the anterior boundary of the anterior horn. Then on the back of the thalamus lies the posterior horn of the lateral ventricle, with the optic radiation sweeping just lateral to it and passing backwards to the occipital pole. Just lateral to the thalamus lies the internal capsule, which is a mass of L-shaped white matter. Its short limb is the anterior limb and lies between the head of the caudate nucleus and the lentiform nucleus. This is the lentiform nucleus. This is the longer posterior limb. It lies between the thalamus and the lentiform nucleus. This is the geno of internal capsule at the junction between the two limbs, and it transmits the corticonuclear fibers. The posterior limb transmits the corticospinal fibers, which are motor, and the superior thalamic radiation, which is the sensory third order neurons from the thalamus to the posterior central gyrus. This is in addition to corticopontine and other extrapyramidal fibers. This is the lentiform nucleus, which is a part of the corpus striatum, The corpus parietum consists of both the lentiform nucleus and the caudate nucleus. The lentiform nucleus consists of two parts. The inner part is pale and is called the globus pallidus, while the lateral part is darker due to the presence of more pigments and is called the putamen. The lentiform nucleus is biconvex, thus resembling the lens or lenticle. The part of the internal capsule behind the level of the lentiform nucleus is called the retrolentiform part of the internal capsule. It contains the optic radiation for vision. The part of the internal capsule below the level of the lentiform nucleus is called the sublentiform part of the internal capsule, and it contains auditory radiations for hearing sensation. Just lateral to the lentiform nucleus lies a band of white matter, which is called external capsule. It consists of white fibers forming a capsule external to the lentiform nucleus, hence its name. The same is applied to the internal capsule, which forms a capsule for the lentiform nucleus, but on its internal aspect. Lateral to the external capsule lies a thin strip of gray matter called claustrum. Claustrum means barrier. It separates the external capsule from the white matter of the insula at the extreme lateral part of the section. This is the insula, and this is the lateral sulcus on the surface of the section. This is the anterior end of the section. This is the posterior end. This is the medial border, and this is the thalamus at the medial border of the section. This is the head of caudate. And this is the lentiform nucleus. And this is the internal capsule. This is the anterior limb of the internal capsule between the head of caudate and the lentiform nucleus. This is the posterior limb of the internal capsule between the thalamus and the lentiform nucleus. This is the geno of the internal capsule between the two limbs. This is the external capsule to the outside of the lentiform nucleus. This is the claustrum, and this is the insula. These are the two parts of the lentiform nucleus. This is the outer black part called the putamen, and this whiter medial part called globus pallidus. Now, let us demonstrate the coronal sections in a stained specimen. These sections are cut in series in the cerebral hemisphere from before backwards. The first coronal section is taken at the level of the geno of corpus callosum and the anterior horn of the lateral ventricle. It shows the anterior horn and the head of caudate nucleus in its floor. Lateral to the caudate nucleus, at this most anterior level, there is neither lentiform nucleus nor internal capsule, but only white matter, because the caudate head projects anteriorly more than the lentiform nucleus. This second coronal section is taken behind the previous section and is taken at the level of the optic chiasma. This is the central part of the lateral ventricle, and this is the caudate nucleus in its floor. Lateral to the caudate nucleus is the anterior limb of the internal capsule. Then the most anterior end of lentiform nucleus, which is fused with the caudate from below and shows also transverse gray connections across the anterior limb of the internal capsule. Hence, the two nuclei form together the corpus striatum as it appears striated. This is the anterior end of the claustrum, and this is the insula. This third section is taken more posteriorly through the thalamus. This is the narrow part of the body of caudate nucleus in the floor of the central part of the lateral ventricle. It lies lateral to the thalamus. Lateral to the thalamus is the posterior limb of the internal capsule, and more laterally is the lentiform nucleus. This is the claustrum, and this is the insula. This fourth section is taken more posteriorly in the posterior horn. Neither the nuclei nor the internal capsule are seen. By this, we come to the end of the gross morphology of the brain, and let us move now to demonstrate the gross morphology of the spinal cord. This is the lower part of the vertebral canal opened to expose its contents, which are the spinal cord and its meninges. The spinal cord is surrounded by three meninges, as the case with the brain. The outer tough fibrous layer is the spinal dura mater, which is partly attached to the bones of the vertebral column. However, the interval between the dura and the bones is narrow and is called epidural space. This is the epidural space which is artificially opened. It contains loose areolar tissue, semi-liquid fat, and a network of veins which correspond to the dural venous sinuses in the cranium. The spinal dura mater is formed of one layer, while that in the cranium is formed of two layers between which the venous sinuses lie. The two sites of attachment of the dura mater to the surrounding bones are to the back of the vertebral bodies and to the intervertebral foramina, where it sends out sleeves over the roots of the spinal nerves. These are the roots of the spinal nerves as they leave the spinal cord and pierce the dura mater to reach the intervertebral foramina. As these roots perforate the dura mater, it gives off sleeves around these roots. These sleeves become adherent to the margins of the intervertebral foramina. Each spinal nerve has a ventral root which arises from the ventral aspect of the spinal cord, and a dorsal root which arises from its dorsal aspect. This is the ventral root, and this is the dorsal root. As the two roots pierce the dura mater, the dorsal root possesses a spinal ganglion. This is a spinal ganglion close to the intervertebral foramen. This is another ganglion, and this is a third ganglion. This is the lower end of the dural sac, which ends blindly at the level of the second sacral segment. This is the second sacral segment, and this is the lower end of the dural sac opening. This is the spinal arachnoid matter. It is very thin and transparent. The space deep to it is called the subarachnoid space and is filled in the living by the cerebrospinal fluid. This is the dura mater to the outside of the arachnoid matter. The space between the arachnoid matter and the dura mater is called subdural space. This is the subdural space, and this is the subarachnoid space. This is the pia mater, which is a vascular thin membrane which adheres firmly to the surface of the spinal cord. The pia mater also extends downwards below the end of the spinal cord as a delicate thread-like filament called filum terminal. This is the filum terminal. It is surrounded by the roots of the sacral and lumbar nerves, which form what is called coda equina, from its resemblance to the tail of the horse. This filum terminal pierces the dural sac below at the level of the second sacral segment to enter the sacral canal and ends by getting attached to the back of the coccyx. The spinal cord begins from the level of the foramen magnum and ends below at the disc between the first and second lumbar vertebra, where it ends in a conical part called conus medullaris. Due to this high level of termination of the spinal cord, lumbar puncture is usually carried out at the level between the third and fourth lumbar vertebrae.